Hi everyone, welcome back to Raaonline. So in the last class, we have studied about the Rickettsial infection, and we have also seen a case study which is pertaining to the Rickettsial infection. So now we will discuss about the multiple choice question that can be asked in this particular Rickettsial infection. So we can learn by case oriented approach, where I will show you a case and I will give you the option, and we will select the best option which is appropriate for the particular case scenario. So let us go into the topic now. So now we are going to the multiple choice question number 1. So here we are going to have a patient. So here there is going to be a 26-year-old male who have attended general medicine outpatient department with the complaints of fever with rash. He had a history of epidemic typhus in the past, and what could be the recurrence of this particular infection called as? So this is a question, and here we are having 4 options. One is going to be the option A, which is enteric fever, option B Katayama fever, option C Shanghai fever, and option D is going to be the Brill-Zinsser disease. So here you all know that enteric fever is caused by the organism called Salmonella species. So there are Salmonella typhi and paratyphi, which is going to cause enteric fever, typhoid fever, and paratyphoid A and B fever, and it's going to be ruled out. Option A is ruled out here, and option B is going to be the Katayama fever. So Katayama fever is usually seen in case of trematode infection, in case of schistosoma infection. So it is going to be the Katayama fever. So again it's going to be ruled out here. Option C is going to be the Shanghai fever. So Shanghai fever is going to be a typhoid-like illness which is caused by the organism called Pseudomonas aeruginosa. So this particular fever is going to mimic typhoid fever, and this is called as Shanghai fever, and the causative agent is going to be the Pseudomonas here. So option A, B, C is ruled out. So here we are left with only one option, that is the Brill-Zinsser disease. So that is going to be the option. So this particular condition is going to be called as recurrence of the particular epidemic typhus. So that's the Brill-Zinsser disease. So here the patient is going to get affected from the particular epidemic typhus, and the patient is going to go for recrudescence, and after the particular years, 1 or 2 years, the patient can develop infection or fever with rashes. So here the particular causative agent is going to be the Rickettsial group. So here is going to be the typhus group, which is caused by the organism called Rickettsia prowazekii. So it is a recrudescent Rickettsia prowazekii infection, that is a recurrent epidemic typhus, so which is called as the Brill-Zinsser disease. And again when we are going to do the wheel Felix test, it can come as negative or weakly positive. So that's going to be the about the Brill-Zinsser disease. So let us go into the multiple choice question number 2.